ഫ്രണ്ട്സ്, ഇന്ന് നമുക്ക് ബ്രെയിൻ ട്യൂമറിനെ കുറിച്ച് നോക്കാം. ഇത്തിരി വാസ്റ്റ് ടോപ്പിക്കാണ്. മെയിൻ ആയിട്ടുള്ള പോയിന്റ്സ് മാത്രം നമുക്ക് കവർ ചെയ്യാം. ഓക്കെ, ബ്രെയിൻ ട്യൂമർ ഇസ് ആൻ അബ്നോർമൽ ഗ്രോത്ത് ഓഫ് സെൽസ് ഇൻസൈഡ് ദ ബ്രെയിൻ ഓർ സ്കൾ. That means it is an abnormal growth of cells inside the brain or skull. Sometimes it can be benign or malignant. That means benign tumor means it does not contain the cancer cell and they don't spread to the other parts of the body and it will not invade the surrounding tissue. Next one is the malignant tumor means it contains the cancer cell and it is more serious and life threatening and it rarely spread to other parts of the body. Okay, and the WHO classified the tumor into two categories, that is primary and secondary. Primary brain tumor means it can be benign or malignant. Okay, and these tumor originate in the central nervous system. And the secondary brain tumor means it originates outside the CNS and it spread to the brain. That means it starts in another part of the body and then it spreads to the brain. Okay, ഇനി നമുക്ക് രണ്ട് ക്വസ്റ്റ്യൻ ചോദിക്കാം. എപ്പോഴും ചോദിക്കുന്ന ക്വസ്റ്റ്യൻ ആണിത്. ദ ട്യൂമർ അറൈസിങ് ഫ്രം ബ്രെയിൻ ഓർ ഇറ്റ്സ് സപ്പോർട്ടിംഗ് സ്ട്രക്ചർ ആർ കോൾഡ് primary brain tumors. Okay, the second one is a tumor spreads from other area of the body is called secondary brain tumor. Next is causes. The exact cause is unknown. Okay, sometimes the cancer in another part of the body is also the risk factors. For example, lung cancer, breast cancer, kidney cancer, bladder cancer, and melanoma. Melanoma means it is a type of skin cancer. And the other factors include is due to the increased age, long-term smoking, exposure to pesticides, herbicides, HIV, AIDS, infection, etc. Okay, next one is the cancer is classified according to the grade and types. Grade 1 is pilocytic astrocytoma. That means in this the tissue is benign and the cells looks like normal and the will grow slowly. Next one is the low grade astrocytoma. In this the tissue is malignant and the cells looks like normal cells. Okay. Third one is the anaplastic astrocytoma. In this, the tissue is malignant and the cells looks very different from the normal cells and they will grow actively. Last one is the glioblastoma. In this, the malignant tissue has cells that looks most abnormal and they tend to grow very quickly. Okay, next we move on to the types of cancer. First one is the brainstem glioma. Glioma means is nothing but within the brain tissue. First one is the brainstem glioma. It start in the brain or spinal cord tissue. Okay, and is typically spread throughout the nervous system. Second one is the ependymoma. That means the tumor arises from the ependyma. Ependyma means it is a tissue of the central nervous system. This case usually seen in pediatric. In pediatric, the location is in intracranial, while in adults it is spinal. Okay. And third one is the mixed glioma. These are tumors that made up of more than one type of glia cell. Okay, these are tumors that made up of more than one type of glia cell. Glia cell means it is nothing but it support the cells in the brain and spinal cord. Next one is the optic nerve glioma. This optic nerve glioma most commonly seen in pediatric cases. That means it is a slow growing brain tumor and it arises in or around the optic nerves. When the tumor progresses, it presses on the optic nerve causing the child vision to worsen. Next one is the subependymoma. That means it is a rare type of tumor that develops in the glia cell, which means that lines in the ventricles of the brain and spinal cord. Next one is the medulloblastoma. It is the most common type of cancer. That means it starts in the lower part back of the brain. Okay, the main cause is due to the genetic problems. Next one is the meningioma. Meningioma means it is a non-cancerous tumor that arises from the membrane surrounding the brain and spinal cord. Next one is the common type of tumor seen in children are brainstem glioma, craniopharyngioma, ependymoma, JPA, medulloblastoma, optic nerve glioma, pineal tumor, and PNET. Okay, pineal tumor means it is forms in the pineal gland. That means it is a tiny gland in the middle of the head, and it produces a hormone called melatonin. Next one is the PNET. That means it is a malignant rare tumor usually occur in children, and the main cause is related to the genetic changes. Next, we move on to the signs and symptoms. According to the tumor site, in frontal lobe, there will be inappropriate behavior, personality changes, memory loss, headache, and motor dysfunction. Okay. In parietal lobe, there will be sensory deficit. And coming to the temporal lobe, there will be a psychomotor seizures and hallucination, etc. And in occipital lobe, there will be visual disturbances. Okay, and the common brain cancer symptoms includes the headache that are usually worse in the morning, nausea, vomiting, lack of coordination, lack of balance, difficulty in walking, memory lapse, difficulty in thinking, and speech problems. And coming to the diagnostic evaluation, CT scan, MRI scan, X-ray, EEG, lumbar puncture, stereostatic biopsy, PET scan, etc. One is the medical management. Medical management includes the radiation therapy, chemotherapy, corticosteroid drugs, osmotic agents, anticonvulsant drugs, analgesics, palliative treatment, etc. Okay, and the surgeries depends upon the brain tumor. One is the surgical management. In surgical management, first one is the craniotomy, craniectomy, cranioplasty, stereostasis, burhole, and shunt procedure. Coming to the nursing management, health history, and if any progression of symptoms, that is any other cancer or any other disease, physical examination such as monitoring the post-op of increased ICP, monitor the fluid and electrolytes, administer medicine such as steroids, and ongoing neurological assessment for any change in the mental and functional status, seizure, infection, hemorrhage, etc., and to prevent the ICP. ICP is the pressure exerted by the fluid such as CSF inside the skull and in the brain tissue. Okay, the pressure exerted by blood brain CSF on cranium is ICP, and the normal level of ICP is 7 to 15 mm of Hg. Okay, that's all for today. Thank you.